Hello and a very good afternoon to all of those joining me live on the Facebook page of News 9. I'm Neha. So a government-appointed panel of scientists and doctors stated that India has crossed COVID-19 peak in mid-September. The panel also added that the virus can be controlled by early next year with minimal active cases by February end, quote-unquote, only if all the safety protocols are followed. The study also warned of possible spike in the number of cases in the festive and winter season. Now, the committee said that 30% population in India has developed antibodies at present. The panel said all activities can be resumed, but only if all the safety protocols are adhered to. The panel is of the view that initial lockdown helped India in controlling the spread of virus, which helped in saving lives. The committee said by August 2020, the COVID-19 related deaths would have been over 25 lakh if there was no lockdown. IIT Professor M. Vidyasagar, who headed the committee, said, and I quote, "If there was no lockdown, we would have had a peak that was 15 times higher in the middle of June, which would have been overwhelming. By enforcing the lockdown in March, we not only reduced the load on our system, but also pushed the peak to September from the projected May end." He said, with no lockdown, the pandemic would have led to a peak load of 140 plus lakh cases by June. Now, to discuss more about whether the virus can really be brought under control, joining me live is Dr. Vivekananda Jha, who is a public health expert. Thank you very much, Dr. Jha, first of all, for taking out some time out of your busy schedule and talking to News 9. So, my first question to you would be, the government-appointed panel is saying that 30% of the Indian population has developed antibodies. Isn't that a large number in itself to begin with?
Yes, sure, it is a large number, and of course we need to understand much more about the methodology which has been used to make this conclusion. What was the test used, how many people were sampled, how random was the sampling, does it represent the entirety of the country, does it represent certain populations? So a number of methodological details need to be made available to all the stakeholders for them to be able to make sense of this data. When I say make sense, I mean for us to be able to really understand the context in which this 30% prevalence estimate was reached.
Right. So, Dr. Jha, the panel is of the view that coronavirus can be controlled by early next year. Is it really possible to control the virus per se? Because we witnessed resurgence in countries where the situation was supposedly under control. Can it really be controlled, until we have a vaccine?
Can it really be controlled? Yes, of course it will eventually be controlled. But I think, as I said, we have burnt our fingers repeatedly. And when I say we, I mean as a global community, having made predictions and then being defeated by the behavior of this virus. So, many countries around the world, including developed countries like United States and United Kingdom, have made predictions about their ability to control the virus. And it seemed at some stage like they had achieved some success, only to be defeated later on by increasing the number of virus cases. This is happening all over Europe right now. We are seeing it. Countries are going back into lockdown. Number of cases is increasing in United States. So while the trends in India are encouraging, it would be premature to make a precipitate judgment about the exact time period by which this pandemic can be brought, quote unquote, under control. Right. I don't even know what is the definition of under control. Is it just that the number of cases that we see at that particular point of time and the number of deaths, they are within some acceptable limit, or that there would be no new cases, or that we would have controlled the spread and we will be able to identify each and every new case as to their source of origin, etc. So the definition of under control also is something that we need to agree on. But I think in summary it is fair to say that we have been bitten again and again by the biological behavior of this virus, which we don't understand. To your specific question of what will a vaccine mean, of course a vaccine is a big step forward once it becomes available. But we also have to realize that in a country like India, making the vaccine available to everyone who needs it and everyone who stands to benefit from it is a huge challenge. India doesn't have a system of vaccination for adults, for example. Secondly, the Indian population is so far spread out. For us to be able to prioritize who should receive the vaccine in the first instance, should they be people who are at highest risk, or should they be people who take care of people who are vulnerable, for example, healthcare workers, etc. So I think it's time that we need to start having those conversations soon in a very transparent manner, and develop policies and practices which are consistent with the values and preferences of our society, and also which makes sense from the healthcare point of view, so that we are able to protect the most vulnerable, and at the same time also make sure that we protect the healthcare professionals who are in the forefront of fighting this battle.
True, very true. Dr. Jha, tell us about the reality of COVID-19 peak in India. You know, the experts say that we hit the peak in mid-September. The panelists, of course, and looking at the current numbers, the active cases in India are way less than the number of recovered from past couple of months. But having said that, the experts also have been giving different versions when it comes to COVID peak in India. What's your assessment?
So my assessment is really that we are lost because we don't have high quality data here. We have the data that we see released officially. From there also, it's hard to make out if there was ever a peak. The number of cases kept going up and down. Of course, according to official estimates, there was a consistent increase until we reached somewhere in the range of 95 to 97,000 cases every day. And since then, there has been a stabilization followed by some decline. But we also need to be mindful of the fact that at this stage, there are a large number of people who are potentially not getting tested, even though they have disease which is compatible, or that there are people who are going for testing in private laboratories from where reporting is less than complete.
Right.
We do understand from talking to our colleagues who work in these communities that a number of members of the community who need testing and now get self-tested don't do so in the government designated facilities, but are going to a number of private facilities that have also started offering these tests using a variety of methodology which are not always proven. If the number of people who are being, declared as having been positive, if that was true, then that doesn't sit well with the prevalence, the 30% prevalence that is being said. So both of them are not consistent. Right. Either the 30% seroprevalence is an overestimate, or that the number of active cases that were being picked up in the last few weeks were gross underestimates.
Right.
So we need to understand a lot of these numbers.
Right. Doctor, we have witnessed an exponential rise in the number of cases in India in the past as well as now. The committee is of the view that numbers could have risen drastically, and the deaths too, if there was no lockdown in place. What do you have to say about the lockdown move, and more importantly, the timing of it?
That's been a matter of debate, hasn't it? And there are widely divergent points of view. And there is no way to really say with any high degree of confidence which one of them is true. It is very difficult to prove a negative point, right? That the number of cases would have been very high had there been no lockdown, because this is not a falsifiable hypothesis. So it's very difficult to say. I think from global experience, it is absolutely fair to say that lockdowns help, and any lockdown would have definitely prevented a rapid spread of infection at that particular point of time. But there is also a debate as to what did the lockdown do to subsequent spread. For example, people who were confined in closed spaces during the lockdown, they experienced a spread of virus within those confined spaces, and subsequently, once the lockdown was lifted, and these people spread out, especially went back to their places of origin, back to their multi-generation families, did they take the virus with them and spread them to those individuals, is something which we will never know, but that's a very realistic possibility.
Right. Lastly, Doctor, the committee has also warned of possible spike in the number of cases in the festive and winter season. What's your word of advice for people, since they would want to go out and celebrate? Pandemic fatigue has also set in.
that's a very wise advice and very wise caution that the committee has provided. It is undeniable that as people come out of their fatigue and want to celebrate festivals, which is also something which there was very little happening during the period of the lockdown, and people want to get out of that mindset and enjoy something, which are the festivals. But again, remembering that these festivals in them also carry the risk of the pandemic coming back in large numbers. So while we do quietly enjoy the festivities, we must make sure that we do adhere to the public health precautions. I think there is no getting away from the fact that it is the simple precautions which are the biggest protections against COVID-19 spread, such as universal use of masks, maintaining distancing, and use of hand hygiene and personal cleanliness. These are the three things. And the more we emphasize and we adhere to those during the festive seasons, I think the more likely we are not to see a resurgence of the pandemic in the coming months, once the festive season has gone. And also let's be mindful that we have winter coming in. And once winter comes in, there will be more and more people staying indoors with much less likelihood of going outdoors where social distancing is easier. So there can be a possible confluence of factors which is not good news, and so we need to be especially mindful during these weeks.
Right. Thank you very much, Dr. Jha, for taking out some time and speaking to News 9. Although the committee has said that COVID-19 peak is over in India, but that doesn't really mean that we should let our guard down. Keep those masks on. Take care of yourself. Stay safe. Thank you very much for joining me. If at all you like this video, do not forget to subscribe News 9 YouTube. Like us on News 9 Instagram, Facebook as well as Twitter. Stay safe.